how would you treat acute sinus infection that lasted 6 weeks? Any quote infection, the first thing obviously I would do is not use that word. You have the buildup of toxic snot in your sinus passages, maybe. But I can tell you that sinus infection is an interesting thing. Having worked as an ER doctor on and off for 7-10 years or so, we were encouraged strongly to document every diagnosis we could with whatever test was appropriate, partly as a kind of medical legal gesture, and I think partly to make money for the hospital. So everybody who came in with a snotty nose that said they had a sinus thing, we did an X-ray of their sinuses. Now, I'm not saying you should do an X-ray of your sinuses. I'm saying that I did that for years because, that's essentially what I had to do, or maybe not had to, but that's what I did. And what it allowed me was to see whether all these people who said they had a sinus infection actually had evidence of a sinus infection on X-ray. And I can tell you, I don't have the exact percentage, but it was probably less than 1%. In other words, if you took 100 people who came in and said they had a sinus infection, and you did an X-ray and maybe even a CT scan on their sinuses and find out who actually has pus in their sinuses, it was essentially nobody. Now, the good thing about a sinus infection from the medical point of view is generally, if you don't do an X-ray, or even if you do, you can always tell somebody they have a sinus infection because they don't know, they can't see it. And so then gives you an excuse to do an antibiotic. Whereas if the same person came in and you said you just have a snotty nose, you probably have a quote virus, then there would be no justification for giving them an antibiotic. And then they would be pissed because they came all the way to the emergency room and you didn't do anything. And then they might come back on the next guy's shift and he's pissed at you for having somebody wake him up in the middle of the night, who you could have given him an antibiotic instead of him doing it in the middle of the night. And all that you did that for was because you saw a negative X-ray and said there was no evidence for a sinus infection. That obviously didn't matter to us. So we did the X-ray, it was negative. We said, well, you can still have a sinus infection, you can have thickened walls or something. So here's the antibiotic. So you can always it became an excuse. But what's really happening, like anywhere, is that you have some toxic stuff, in this case mucus, that you want to get rid of. And so you liquefy your cells and make them into mucus. And then if it's really toxic stuff, then the bacteria come to eat it, and that turns it green and yellow. That's nothing to do with whether it's a virus or a bacteria. It's only to do with the degree of toxicity of the mucus. So anything you can do to, that's a case of probably fasting and doing, bowel cleansing, and inhaling with turpentine works great for this sinus congestion, and taking lots of liposomal vitamin C. All that is fairly easy to treat, just maybe a couple days of a broth or water fast, some bowel cleansing, some inhaled turpentine, and liposomal vitamin C, and maybe some golden seal, and you should be fine.